Welcome to Womxn Things The Podcast, a show dedicated to women who want to connect with their bodies and optimize their health for a more holistic and balanced life. We are your hosts and women's health experts, Kara Moore and Kirsten Humphries, and we will be taking you on a journey of education and empowerment.
Stay tuned each week while we break down all the hottest topics in women's health today, including food and nutrition, periods, gut and skin health, fertility, and everything in between. You can find us on Instagram at Womxn Things, that's woman, WOMXN, and subscribe on your preferred podcast platform to keep up to date with all the latest episode releases. We hope you enjoy the episode today, and thanks so much for tuning in.
So hello and welcome to our first episode of the second season of Womxn Things The Podcast. Kara and I have been, let's celebrate. Kara and I have been doing lots of stuff over the summer, and we've been doing lots of planning recently. We've even been a guest on someone else's podcast, so there's been lots of exciting things happening with us. And yeah, we're really, really excited to bring you this new season. We've got lots of great guests lined up, lots of great topics. We've decided to start the season with this episode in particular because it was our most requested episode topic from the last season and the most questions we got asked from other people. So on today's episode, we're talking about hormonal birth control and how to basically safely come off hormonal birth control without a lot of the side effects that come along with it. So to start things off, we are going to introduce ourselves. My name is Kirsten. I'm a naturopathic nutritionist and women's health coach, and I help busy women struggling with PMS, hormonal imbalances, and stress manage their symptoms with nutrition, mindfulness, and healthy daily habits so they can live an amazing life. And like always, I'm joined by Kara, my BFF and co-host.
Thanks, Kirsten. So yes, I'm Kara. I'm a clinical nutritionist and natural fertility educator. I've dedicated my online practice to helping those who are struggling with their PCOS symptoms and improve their fertility. So you can find me on Instagram at fempowered_health or on my website, www.fempoweredhealth.com. And you can find Kirsten on her Instagram at Kirsten Health or on her website, www.knhwellness.co.uk or .com.
You got to start as you go on, right? Last season. Always forgetting to say that.
Always, every single time.
I even have it wrote down, but so my Instagram name has changed. It's not Kickstart with Kirsten anymore. It's at Kirsten Health. That's why that's different this season, but let's get into it, shall we?
Yeah, big episode today. I guess we should start off just basically with an introduction on what hormonal birth control is and how it works in the body. So hormonal birth control is a form of birth control which uses synthetic hormones, normally a synthetic estrogen and a synthetic form of progesterone called progestin. So you will probably be familiar with hormonal birth control as the oral contraceptive pill. So we have two types, which is the combined oral contraceptive pill and the progesterone-only pill, which is normally known as the mini pill. But other forms of hormonal birth control can include the Depo-Provera injection, the Mirena coil, the Nexaplanon implant, so the rod that you get inserted into your arm, the Nuva rings, which you can insert into the vagina, so they're the ones that you put in and take out, as well as the contraceptive patch. So some of these you might already be quite familiar with. Some of them aren't used as often. And it's really something that you will decide upon with, your GP or gynecologist about what's the right type of hormonal birth control for you. So the way that hormonal birth control works, I feel like I've said hormonal birth control so many times in the last 3 minutes. The way that it works is it basically interrupts or shuts off our natural hormonal cycle. So it interrupts the communication between the brain and the ovaries, which is the way that our body naturally produces our own sex reproductive hormones and how we ovulate. So by dosing at a specific dose with these synthetic versions of our sex hormones, so the estrogen and progestin, it can kind of mimic a state where our brain thinks that it doesn't have to send any stimulation to the ovaries to ovulate. And it basically just kind of cuts off that feedback cycle. So we no longer produce, in most cases, our own natural reproductive hormones. Of course, that's going to depend on the specific type of contraceptive you're on. Okay, so it shuts down our hormonal pathways and it prevents ovulation. So that's one of the main ways that the hormonal birth control works. It does also work in a couple of other ways. So it can change the cervical secretions that we produce throughout the month. So as we're no longer ovulating, we're no longer producing fertile mucus. So for sperm to live inside our reproductive tract and be able to make its way up the fallopian tubes to meet an ovulated egg, we need fertile mucus to be present. So without the presence of fertile mucus, essentially our reproductive tract is quite a hostile environment to sperm. And the type of mucus that we'll be producing is actually quite thicker in consistency, and it can create a plug at the top of our cervix, essentially blocking sperm from entering our reproductive tract. So that's another way that the hormonal birth control works to prevent pregnancy. And one of the last ways it can change the environment inside of the uterus, so our uterine lining. And it basically prevents the lining from like growing nice and thick and becoming like a really nice nourishing environment for implantation to occur. To sum all of that up nicely, basically hormonal birth control is made from an artificial form of our sex hormones, so estrogen and progesterone, and it basically stops our natural menstrual cycle from occurring, and that's how it stops ovulation and a potential pregnancy.
Yeah, so just on that note, just to do a little bit of myth busting here, is when you're on the pill, you don't actually have a real period. So the bleed that you're having, it's not actually a real period. The bleeding's technically called withdrawal bleeding, and it's referring to the withdrawal of your hormones from the pill when you are switching to the sugar pill. So technically it doesn't actually make sense to have a period as it's not a real period when you're on the pill. So that's just like a common misconception, and I think not really known by a lot of people. Certainly when I was younger, I didn't know that, and I was always really paranoid. If I wanted to skip my period when I was on the pill for like a certain event, I got really paranoid about it. But actually it's okay because you're not actually having a real period on the pill. So that's a myth bust number one.
Yeah, and I guess as well, just to clarify, like what a real period is. So a real period is a bleed that follows ovulation. So to get a real period, like you have to have ovulated beforehand.
Yeah, exactly. And that's a huge misconception. Actually, like the main event of your cycle is not even the bleed, it's actually the ovulation. So it's important to know if you're ovulating because it means that your hormones are actually working correctly. And in contrast to the pill, if you're on an IUD as an example, you may actually still be ovulating and not bleeding. So different forms of birth control can work in different ways. And the bleed itself that happens when you are ovulating is really just a result of like a natural part of your cycle. It's actually as we said, the ovulation, that's the main part. So it's worth noting that you may still have a bleed when you don't ovulate, and this is called a breakthrough bleed. And this can occur commonly with women who have PCOS or those who are not eating enough. So really important to address those two things if that's something that be relevant to you.
Yeah, definitely. So those shorter type cycles, or maybe those bleeds that are quite irregular in pattern to what you're normally experiencing a period bleed to be like, right?
Yeah, definitely. So if you're on the pill, the main purpose of the pill is to prevent you from ovulating. So what it's doing is actually suppressing your natural hormones that would normally be sort of like flowing throughout your cycle. And so when you're on the pill, these have been suppressed. And this may be negative as it can interfere with the natural maturity of your body's own hormones and have some side effects that go along with it. And Kara is going to mention to you those in a second now. But I'd just like to mention, if you would like to learn a little bit more about your cycle, do refer to some of our previous episodes in our first season, because we have a few where we discuss the menstrual cycle in particular. And there's a lot of detail in there how you can work with rather than against your cycle and your body to optimize your health. So I think that's episode 1, 3, and 10 in particular. We have a lot of information on the cycle and how to support yourself there. So do check those out. But Kara is just going to run you through now some of the side effects of taking hormonal birth control.
Yeah, thanks, Kirsten. So as I said before, the synthetic hormones that we get in hormonal birth control are similar to our reproductive hormones in the way that they can still bind to the right receptors in our body and have the ability to, switch off ovulation and our menstrual cycle like we've spoken about, but they aren't exactly the same. So they don't do exactly all the same things that our normal reproductive hormones do. They also have the ability to have a slightly different effect, so bind to different types of receptors in the body and have effects that our normal reproductive hormones wouldn't normally have. So the side effects of hormonal birth control can be contributed to a couple of things, and I'm going to briefly talk about them now. Most pills use the same type of artificial estrogen, which is derived from a source of estrogen, but the progestins found in our hormonal birth control, and most of them are derived from testosterone. So that's our male sex hormone. So what that means is, these progestins, while having a similar effect to progesterone, not the same, but similar, they can also have a similar effect to that of having excess testosterone in the body. So that can cause symptoms such as acne, weight gain, changes in mood, as well as things like hair loss from the scalp and excess hair growth on the body. But the last generation of progestins is actually not derived from testosterone, and it's derived from a different substance called spironolactone. And it is actually a naturally anti-androgenic compound, and it can help with things such as acne and excess body hair growth. But as a side effect, it actually also blocks our own body's natural production of testosterone. And while I've just described testosterone as having some quite negative effects in the body, when it's in balance, we actually really need it for things like our libido, our motivation and energy, as well as just kind of like feeling a lot of like stamina and excitement for life. So when in balance, testosterone is actually a really important thing for us. So apart from all of that, not having the natural production of progesterone and the nice effects that it has on our body and kind of the counterbalancing effects it has to estrogen can contribute to kind of a hormonal imbalance or a more estrogenic state in the body, which also can lead to more symptoms associated with being on hormonal birth control, especially things such as, fluid retention, bloatedness, again, changes in mood, cystitis, urinary tract infections, an increased incidence of allergies, some nausea, headaches and migraines, and things like that. So I've kind of listed, a lot of the commonly experienced side effects that maybe a lot of you listening might have experienced while being on hormonal birth control. But I just wanted to go over some less commonly known side effects, or some of the things that are less commonly discussed or you might not have actually associated with taking hormonal birth control. So to start things off, some of these side effects are, like I said, less common. So they can be quite rare, and it doesn't necessarily mean, that you're going to experience all of them. But I think the thing that Kirsten and I really want to highlight is that most of this isn't brought to your attention when you are offered to take hormonal birth control. So it's important to understand, the risks associated so you can make an informed decision about your health. And I think that's the issue. A lot of practitioners and, women's health advocates are kind of speaking about at the moment is that, these things just aren't being discussed or considered. So to get started, I'm just going to roll through the list. So issues with eyes and eyesight is one of them. Changes in metabolic markers. So these are markers that we can test for in the blood, which put you at risk for certain chronic diseases such as diabetes, heart disease, and stroke. So it can include an increase in blood insulin and a reduced capacity to regulate our blood sugar after a meal, some inflammation markers and liver, and cholesterol. Generally, liver function is also decreased in all hormonal birth control users, and there is reduced production and utilization of thyroid hormone in the body, increased risk of blood clots due to an increase in clotting factors in the blood and a slight decrease of anti-clotting factors. Common nutrient deficiencies found in women on long-term hormonal birth control use include magnesium, zinc, B vitamins such as B12, B6, B9, so really important nutrients for our mental health, fertility and detoxification processes, as well as vitamin C. The pill can actually shrink our ovaries when we're on it for a long period of time, and also shrink the cells that create that fertile mucus in our cervix, so required for reproductive purposes. There is also a slightly higher risk of breast cancer for those who use certain types of hormonal birth control versus those who have never used them. However, the pill may also have protective effects against other certain types of cancers there.
I just wanted to add on that because I'm just thinking about my own experience on the pills. I went on the pill when I was younger, and I came off the pill, and then a couple years later I had to get checked for cysts on my ovaries, and the gynecologist who was working with me at the time had said, like, oh, she was like, are you on birth control currently? And I was like, no. And she said, that's interesting because your ovaries have actually changed shape, and she said you might have trouble getting pregnant when you're older. And that was a result of being on the pill. So that it's just something that can happen. You know, it's not super rare all the time. It's, you know, it can happen to a lot of people. But yeah, it's just worth noting that, like, yeah.
That's so interesting. I know, like, with the reduction in the cells that create the fertile mucus, that is definitely reversible, but I'm not actually sure about changes in ovaries. So that's definitely something I want to look into myself.
Yeah, I'm just thinking about that now. Like, I don't know the long-term answer to that, but I should really look into it for my future if I ever decide that's the path I want to go down.
Yeah, definitely. A couple more on the list really quickly. So, like, a delayed return of normal menstruation or ovulation. So that's a delayed return of fertility, which I'm going to discuss in more detail shortly. And lastly, adverse effects on our gut, vaginal microbiome, and gastrointestinal lining. That's quite a lot going on there, and I don't want to scare anybody, but I think it's just, I guess, appropriate to have the conversation and to speak about the things that hormonal birth control can do to the body. I just wanted to add on, so hormonal birth control can also change the way that we see sexual partners, the passion or motivation we feel for life, our appearance, so also the way we present ourselves to the world, our interests and hobbies, and basically like everything in between. So there's a really good recommendation for a book that we have that I would definitely recommend to anyone listening who wants to learn more about this, because it's so absolutely fascinating. And it's How the Pill Changes Everything by Dr. Sarah Hill. And it's a really non-biased explanation of all the science and research behind hormonal birth control and how it changes bodies and our brains, and as an effect, basically who we are as human beings. And yeah, it's a really great, interesting read.
On the topic of being unbiased, I've just wanted to share some instances when the pill may or may not be appropriate. Sometimes it is appropriate, and it's always just really individual. The pill can be helpful to those who are having a period to reduce some of the sort of nasty symptoms that they may be experiencing from their cycle. And this can include really heavy flows, irregular periods, extremely painful periods, acne, as you mentioned, and of course, to reduce the risk of pregnancy.
Yeah, I've had bad experiences with hormonal birth control, and I've had negative symptoms associated, but at the same time, you know, I don't regret going on it in my younger years because I definitely didn't have the emotional maturity and I guess responsibility to have made any other choices that would have, you know, prevented an unwanted pregnancies.
Yeah, I mean, and you know, everyone has an individual preference as to what they prefer. So as you said before, you know, you need to weigh up your pros and your cons always, and discuss it with your healthcare provider or your gynecologist or nutritionist, whoever you're working with always. And that goes to really anything. Many of the reasons, as we mentioned, this is why women with endometriosis, as an example, often opt for the pill in order to get control of their symptoms so they can really just start living and not have to suffer so much. Because, you know, sometimes if you're suffering with really painful periods, as an example, it can really change your life. It can affect your work. You're literally bedridden because you can't control the pain. So in some of these instances, you know, like natural healing, as an example, does take a little bit longer. So sometimes a more immediate relief is necessary in order to help someone sort of get back to living their life, really. But like most medications, as we mentioned, or Kara had run you through, there are negative side effects. And yeah, so just do your research and, you know, listen to podcasts like this. You know, everything that me and Kara put out is evidence-based. So we are actually like fact checking everything we're telling you is correct. So we really want to provide the best information possible in an unbiased way. But having said all that, as we are natural practitioners, we know that sometimes taking medications for more chronic issues can be a cause for concern, because sometimes there's an underlying reason as to why you're experiencing the symptoms that you're experiencing, and there are often ways you can address this as well. So if you're taking the pill, as an example, you could possibly be masking something more serious that's going on and miss a diagnosis like PCOS or thyroid disorders. That really needs supporting in so many other ways. And this includes like a healthy diet and lifestyle. Sometimes supplements are beneficial to support your body's own natural functions, and, you know, mental health support, anything like that. That's why it's sort of like when you take the pill or any medication, you're sort of like putting a Band-Aid on the issue rather than figuring out what the issue is. And that's like our main job as natural practitioners is to kind of go in to figure out, like, go through your medical history, go through anything that might be going on, so we can, if we need to send you off to your GP to get a diagnosis or whatever that may be, just to figure out how we can address some of the symptoms that you're experiencing as a whole person approach, rather than just that, you're having painful periods, this is the pill, but it's why are you having these painful periods in the first place that we really need to figure out.
Yeah, and just like quickly add on there, it's not one or the other, right? You can work on both at the same time. So if you're working with a practitioner who is kind of shaming you from wanting to take medications or to use the hormonal birth control and you feel like it's the right one for you, then, maybe it's time to find somebody else who's going to work in a more complementary manner.
Yeah, no, that's so true. I did, just to kind of put this in perspective, I did kind of write here for myself an example to tell you guys. But so if you're looking at something like PCOS as an example, and you're going on the pill for the PCOS, which will help control a lot of the symptoms that you're having. But we know that one of the many drivers of PCOS can be insulin resistance and issues with blood sugar control. So this not being addressed could eventually increase your risk of type 2 diabetes in the future. So you could, as Kara said, go on the pill, but also, if you know what's going on before you do that, then you can also address the issue with your blood sugar regulation and end that all off. We've kind of spoke a bit about it already. I think Kara's spoke to you about our own natural hormones, but there are benefits of having our body's own natural hormones, and these could include helping with immune function, helping with inflammation control, building healthy bones and muscles, helping with the promotion and growth of neurons, and helping with mood regulations, plus so much more. So like, you could really talk about this topic for a really long time, but there's, I guess, pros and cons of both, really just figuring out always the root cause of things and then addressing it from there.
Yes. So I guess to speak more about today's specific topic is like how to actually transition off hormonal birth control safely. So I think what is the concern behind that question? I'm just going to speak to. So you might have decided that, hey, hormonal birth control is not the right thing for me anymore. I want to see what my natural cycles are like. I want to experience my natural hormones, but I'm concerned about having symptoms coming back, or I'm concerned about, having a delay in return of my fertility. So I'm going to start with talking about fertility. Coming off hormonal birth control, there can be a delay in return of menstrual cycle. However, 81% of people who were taking the combined oral contraceptive pill and were trying to conceive were actually pregnant within 12 months of coming off the pill. It is important to note that progesterone-based hormonal contraceptives have a slightly lesser, they have a slower return to ovulation, which can be a slower return to fertility and pregnancy. And what the statistics are saying is that there's 76% of people who were trying to conceive and had come off a progesterone-based hormonal contraceptive are pregnant after 12 months of their removal. So just a reminder, those are the mini pill, injection, the rod, and Mirena IUD. So they're quite good statistics. I think in total, like post-pill amenorrhea does only affect around 1.7% of people, which like when we're talking about like percentages, that does seem quite small. But like when you think about how many people are actually on hormonal birth control, it is quite a significant number of people who might have issues with return of menstrual cycle. But it's like more important to, again, address, what is going on there, what is the underlying reason of return to fertility, and what maybe could have the hormonal birth control been masking, as Kirsten was saying. So more research is definitely needed in these areas, but my biggest piece of advice would be, to allow a little bit of a grace period when you come off hormonal birth controls if you are trying to conceive, which can just take some of the stress and anxiety out of, I guess, being in a rush. Because typically, what a typical scenario, and this is a stereotypical scenario, but like a woman might be on hormonal birth control with her partner, and then they might get married. Again, a very stereotypical example, but then the couple might decide that they're ready to conceive. So the woman will come off hormonal birth control. She might have been on it for, let's say, 12 years. And then there's all of a sudden like a lot of pressure and a rush to conceive and have a baby. And it doesn't really allow enough time for return of menstrual cycle, return of ovulation, and good quality egg quality and good quality menstrual cycle and ovulation, all of those things that, improve chances of conception. And, they're trying for, let's say they're trying for a year, it doesn't happen. And as we can see, at least like 20% of people are not conceiving within a year after coming off combined oral contraceptive pill. And then that kind of puts them in the category for infertility. And then, they're on their way of trying for IVF or dealing, with the stress that comes with having an infertility diagnosis slapped on them, like just might not be the case at all. So more or less in these circumstances, I don't think that it's actually the pill which has caused a delay to menstruation or infertility, but it probably is something else that's going on underlying that's been masked or covered over by taking the hormonal birth control. So, things like PCOS, thyroid conditions, hypothalamic amenorrhea, and all things like that can be missed, as Kirsten was saying, when we are taking the hormonal birth control. And these are all things that can severely affect when untreated, can really affect our ability to conceive and have a regular menstrual cycle. So the second issue that is a concern when coming off hormonal birth control is if you did go on for symptoms that you're experiencing previously. So again, as Kirsten said, painful or heavy periods, PMS or PMDD symptoms, PCOS, endometriosis, acne. So I think there's a lot of fear that, once you come off the hormonal birth control, that those symptoms are going to come back with a bit of a vengeance. Don't get me wrong, that can be some people's experiences. And again, that shutdown of our hormonal system can certainly mask, the underlying cause of what's driving those symptoms. So while we're not addressing that, when we take away that Band-Aid, some of those symptoms may be likely to return. A really important one there for a lot of people is the post-pill acne. So a lot of people go on the pill in their teenage years or late teenage years to help with breakouts. And again, without addressing that kind of underlying cause. So Kirsten's going to chat about strategies to support yourself during that period. But I think that it is important to have a realistic expectation in terms of perhaps some skin changes when you're coming off hormonal birth control, and what is going to happen over time that's kind of really going to balance itself back out. But also, I don't want to scare everybody there, because that might not be the case for a lot of people. A lot of people come off hormonal birth control and don't have any issues with their skin. So it's like really a case by case thing.
Okay, so let's get to the juice. The main event of the episode is how to transition off the pill and what can you expect. I'm going to go through each of the points, but kind of sum this up. I think Kara's just kind of explained some things you can expect, but to sum up, to make the transition easier, you'd want to be doing things like optimizing your digestion and gut function, supporting your liver, restoring nutrient deficiencies that may have been caused by the pill, and looking at your diet and how you can optimize it for blood sugar regulation and increasing the diversity of some of the foods that you're eating to support your microbiome. So this is your healthy bacteria within your gut. And ideally starting to support yourself before you come off the pill so your body has what it needs to function properly. So some examples of this might look like, if we're looking at gut function and digestion, minimizing stress and practicing mindful eating with minimal distractions, and chewing your food very well, and as this promotes better digestion and optimizes nutrient absorption. And actually giving yourself time to sit down and eat at meal times to aid in the digestion process is really important. Eating plenty of fruits and veggies and anything to increase fiber consumption to help make healthy stools. So ideally with your stools, you want to be going between 1 and 3 times per day. And, if you are having some gut issues like constipation or diarrhea, addressing that, you could see a practitioner for that as well. But our gut is so important for our overall health. And this includes our skin, our hormones, and just everything really. So gut is a really good place to start. And also looking at things, increasing probiotic rich foods in the diet and prebiotics as well, to actually feed your healthy bacteria. So if you are having more serious digestion issues, maybe working with a nutritionist or health professional can help you get things back on track there. But some really easy practical things, as I said, is practicing mindful eating, chewing, and eating lots of fruits and veggies. So that's kind of one main point. In terms of supporting your liver function, you want to be eating foods that aid in liver detoxification, like leafy green vegetables, cabbage, kale, broccoli, or cauliflower, and eating healthy fats, including olive oil and avocado, and then trying to minimize some of the more inflammatory oils, such as canola and soybean oil. And sometimes supplements are appropriate as well. And certain herbs like milk thistle can be used to support liver detox. But if you are on the pill and still using it as a form of pregnancy prevention, be very careful with herbs because they can actually interact with how the pill is working. So that it's something just to be mindful of there. But yeah, oftentimes if you're going to start herbs, it's better to speak to a health practitioner anyway. And increasing nutrients like B vitamins and vitamin C are also going to help in liver detoxification, and just really addressing some of the main nutrients that can be drained from taking the pill, which include folate, B12, and other B vitamins, zinc, magnesium, selenium, vitamin E, and vitamin C. So looking at foods to increase those, and sometimes a supplement may be appropriate. So you have things like your nuts and seeds, healthy fats, fruits and veggies, green leafy vegetables, as I said before, and also making sure we're addressing blood sugar regulation. So this would look like including healthy proteins and fats in each meal and snacks, in addition to what you may be eating. So healthy fats could include, avocados, olives, olive oil, nut butters, anything like that. And then healthy proteins could include fish, chicken, soy, lots of things like that. But you do need to make sure that we're including those food groups in every meal and every snack to help with blood sugar control. And Kara and I actually just recently followed someone on Instagram called the Glucose Goddess, and she's got a lot of really nice information about blood sugar control and certain foods, like how you can sort of like pair foods together to create more balanced levels. And she's got it all kind of graphs, and it's nice like visuals to look at to really get things into perspective. Another way of supporting your body is through sweating. So, things like saunas, exercise, and drinking plenty of water, and doing things like supporting your mental health with mindfulness and meditation, self-care, doing things that you love doing as well to create a more enjoying life, basically, can all help bring your body back into balance. And stress reduction as well. So addressing any stresses in your life that may be triggering some of the other symptoms you may be having, or fueling some of the other symptoms you may be having. So that's kind of like sort of quick run through of how you can address going off the pill. And a lot of these can start even before you come off. So ideally starting even like a few months before is optimal, so that your body's kind of getting everything it needs to thrive once you're off the pill.
Definitely. I think that's the key takeaway, especially if you went on the pill for a specific condition or symptom, to start addressing that with a more root cause approach before you come off the pill.
And if you are still experiencing some of these symptoms long term, then definitely it might be worth reaching out to your GP and letting them know what's going on, because if you had been masking something, as we said, then this might be something else that needs to be addressed.
Yeah, and better sooner than later. As I said, you don't want to get yourself into the position where you are feeling like you are in a rush to conceive, but then you've got all of these fertility issues to work through, you've got a new diagnosis or something like that. So, sooner rather than later, just like having a look at what's going on. So thanks, Kirsten. And, birth control is really important for a lot of people and couples, especially if they do not want to conceive. So there are a lot of non-hormonal based birth control options, which are quite effective when used with perfect use. And they can include, condoms, diaphragms, learning the fertility awareness method, and the copper coil IUD. So you do have other options there that you can use that don't have an effect on your menstrual cycle and your natural hormone production if you wanted to use a non-hormonal based birth control method. But it is, about researching and finding out what's best for you. Again, contraception isn't just the person with the uterus's responsibility. It's also the responsibility of both the couple. So, having good communication with whoever it is that you're having intercourse with is really important, so you can kind of find something that works for you both.
Yeah. Also too, I just thought of something as well that's also really supportive for people that I should have mentioned before is looking at alcohol intake and caffeine intake. So caffeine, ideally having with food if you're having it in the morning, and limiting alcohol so we're not binge drinking too much, is all ways that we can also support our body. And Kara's got some books wrote down here that might be useful, called Beyond the Pill from Dr. Jolene Brighton, and as she mentioned before, How the Pill Changes Everything by Dr. Sarah Hill. So that's kind of it for today. Kara's going to take us away with some key pointers from the episode, and then we'll say bye. And yeah, thanks all for listening.
Yeah, actually, I have a couple of questions that people have sent in from Instagram that I thought we could cover at the end as well. So maybe we'll do those now, and then I'll do the key takeaway point. But
Sounds good.
yeah, so somebody has asked that they haven't gotten a period since coming off hormonal birth control and they're not pregnant. Is this normal?
The word normal.
Yeah, the word normal. So I spoke a little bit before about, the return to fertility or return to ovulation in a normal menstrual cycle and how it can be delayed. I think that it depends when you have come off your hormonal birth control as to whether this would be classified as normal or not. But I think that there can be expected to be a little bit of cycle irregularity and cycle pattern changes as your brain and ovaries re-establish that communication. So if you haven't returned to ovulation, I guess in more than, I'm just gonna say 3 months, then I would most certainly get to your GP for some investigations and see if there's anything underlying going on there. What do you think, Kirsten? Is that what you would agree with?
Yeah.
Yeah?
Yeah. I don't know if you saw, but I was nodding my head.
Nodding along. Okay. And then the next question we have is, how might I feel different coming off hormonal birth control?
That's a good question, but I guess it's really independent on the person, right? Some people might feel quite empowered that they are taking charge of their own cycle and their own body. I know I certainly did feel quite empowered after coming off the pill. And even though I did struggle with acne, I still felt it was the right choice. But then I guess some people might feel quite anxious, right? They're not sure what's going to happen. They're not sure, they don't want to fall pregnant. They're not sure if they can rely on other forms. They might not feel comfortable asking their partner to use a condom. So as you said, just making sure you have great communication skills with your partner, whomever you're having intercourse with, and really, just trust that, your body is amazing and can do amazing things is what I would kind of say to that. Do you have anything to add?
Yeah, I totally agree with what you were saying. I think it's just, also how are you feeling on birth control? Is there something that you want to see changed? I hope that happens for you. But also, again, going back to how the pill changes everything and how it influences our personality, interests, hobbies, how we appeal, how interested we are in our life and all of that. One last question, and it is there any particular birth control that is best for PCOS? I'm getting the depot injection in a few weeks.
That's going to be your realm of expertise, isn't it? Since you're specializing in PCOS?
Yeah, so actually it's not my realm of expertise. I think any recommendations for hormonal birth control are best made by your GP or gynecologist. So while we can give you both sides of the story there, it's definitely not in a nutritionist's scope of practice to make recommendations on drugs and medications.
Yeah, I was thinking I don't know how to answer that. I was throwing it at you, but...
Yeah, so I think, the only piece of advice I can say is to, weigh up the pros and cons of getting it, see how you feel and take note of it, any changes in your symptoms, and, just if it doesn't feel like it's the right fit for you, then, bring that up with your GP, your gynecologist, and ask for a different alternative. And as well, make sure you go back and listen to all of the things that Kirsten was saying about supporting yourself while on hormonal birth control, because while the injection might mask some of the symptoms that you're experiencing with PCOS, it's not going to be addressing the underlying drivers. So what you want to make sure that you're doing is addressing all of those things for better health and long-term health, and as well return in fertility if you do decide to come off hormonal birth control and want to conceive, at the same time as using this as your choice of contraception.
Okay, all very good questions. I'm conscious that we are running out of time, so let's quickly shoot through the main points and then sadly say goodbye to you for now.
Yeah, so to wrap it up, you are in charge of your body. You are the one who should decide if hormonal birth control is right for you, not your GP, not us, not any influencers, not something that you read. We really want to encourage you to get all of the information and make an informed choice about your body. At the end of the day, the decision is yours. If you are having side effects from your hormonal birth control and you feel like hormonal birth control is the right type of contraception for you, then do reach out and speak to your GP or specialist and maybe try a different form of the pill, a different dose, something that might, help you reduce your symptoms. Again, as well as going back and listening to all of the ways that you can support yourself. If you went on hormonal birth control for a specific reason, please know that it is not a cure, it's a band-aid. We've spoken about that a lot today. It is simply masking the real problem, and you're most likely going to have to address it at some point. So just keeping that in mind and allowing yourself enough grace period if you want to come off hormonal birth control to have a baby, to correct any nutrient deficiencies, have a return of menstrual cycle, start producing really good quality eggs, and also have enough time for that 3 to 4 months of preconception care. If you have any issues when you are coming off hormonal birth control, don't wait to reach out, and I would recommend seeking help immediately and seeing a women's health specialist such as Kirsten or I to help support your body if you do want to transition off, or whether you just want to make sure that you're addressing all of the underlying drivers for a specific condition while you are on hormonal birth control, and just looking after your general health and well-being in general.
Amazing. That was a great sum up. Thank you so much, Kara. And thank you everyone again for listening. Much love to you all. Have a fantastic day. Till next time. Thank you for listening to our show today. If you enjoyed this episode, please make sure that you subscribe, let us know what you thought in the comments, and share it with all the important women in your life. There are plenty more of these episodes to come, so please visit our website to stay in the know. You will find us at womxnthings.com. That's WOMXN. Much love, Kirsten and Kara.
The information contained in this podcast is not intended to treat, diagnose, or replace the advice of your healthcare practitioner. Always consult with a qualified health professional if you have a pre-existing health condition or are currently taking any medications before making any changes to your diet or lifestyle.